As a gerontologist, one of the areas that I talk about, and I've been talking about this for over 35 years, is caregiving. Just the whole notion. My mom was a nursing assistant for 30 plus years. I work with nurses, nursing assistants, caregivers in the home health caregivers paid, but family members unpaid. The husband, the wife, the significant other, the oldest daughter. In my case, the youngest child and the only son, was a caregiver to my mom for 16 years, with a lot of help, of course, from my wife, my family, our dogs, and our daughter, Karina. So my topic today, and I hope that this will resonate with you, share it with anybody that you possibly can. I wrote an article. It's on my blog. It's great to read and print or scan or share. Please do. My topic, or just tell them about the video. My topic today for you is caring for older adults, but those with neurological conditions. This is a very serious topic, and it can be a very sad topic, but hopefully you'll enjoy it, it'll resonate with you, and you'll pass it on. So many neurological disorders like traumatic brain injury among younger people, TBI, dementia and Parkinson's disease later in life. These are associated with chronic impairment in physical and mental dependence and activities of daily living. If the neurological disorder lived by itself, contained, in a box, and it didn't cause other co-occurring problems, that would be better, but that's not reality. The level of dependence and need for care depends on the diagnosis, the severity of the condition, and the presence of either behavioral or psychiatric issues. They make the disorder a little more challenging as a caregiver. A concept in the scientific literature called caregiver burden, and I'm going to explain that term. It's not negative. Caregiver burden is used to describe a number of factors associated with the caregiving experience, stress, and possibly caregiver burnout, which is a bad place to go. This is an important concept, caregiver burden, especially for those providing care to adults who are diagnosed with neurological disorders. Now, let me give you a snapshot of the caregiver. Who am I talking about? In the United States and around the world, care is typically provided at the care recipient's home, where they live, or the caregiver's home. I might move my mom into my house, for instance. Or, we'll just give mom care in her home as many hours a day as we can. The caregiver is usually a female family member like a wife, daughter, daughter-in-law, partner, sibling, or a more distant relative. Care will be provided in the home as long as it's manageable. And that's the case that we had with my mom. 16 years, and then after a number of falls and falling on her head and setting things on fire on the stove and so on and so forth, it was a very, very tough day when I brought up assisted living. So you get to the point where it's unmanageable or unrealistic or dangerous. And then caregiver burden might become overwhelming, overly stressful. The family now is talking about looking for care outside of the home, including assisted living communities, skilled nursing centers, or they might try to find home health prior to that move. Here are some common neurological diagnoses that we're talking about. Caring for older adults with neurological disorders most commonly include the following: dementing illnesses caused by neurodegeneration, stroke, vascular conditions, metabolic disorders, toxic substances, or terrible, dangerous side effects of medications, Parkinson's disease and atypical Parkinsonian syndromes, neuromuscular conditions like muscular dystrophy and ALS, brain disorders including epilepsy, traumatic brain injury, severe migraines, malignant brain tumors, motor neuron disease, chronic pain, and neuropathic pain. That list could go on forever. Providing care in the home can be challenging and stressful for the caregiver, especially as the health condition worsens and the physical and or mental status of the care recipient deteriorates. Many factors make caregiving difficult and increase the risk of caregiver burden, including care recipient features like being male. Taking care of men is tough, and apparently, according to the scientific literature, tougher than taking care of females. Advanced age. Why? I'm becoming very frail. I can have lots of comorbidities. Cognitively, memory impairment, so on and so forth. The severity of the condition, the number of comorbidities, behavioral and psychiatric issues, motor impairment. I can't get up and move. Intellectual or cognitive difficulties, impairments in speech and communication. All of these just make the caregiving picture incredibly more complex. Any combination of these can increase the risk for stress, burnout, and high levels of caregiver burden. So, let's talk about this concept. What is caregiver burden, Jim? Why do you keep saying that? The word burden is not meant to connotate negativity, as in, my mother is such a burden to care for. That's not what this means. Okay, so rather, it's a concept that attempts to capture aspects and consequences of care and is generally scored on a range. So it's like a scale. From mild to moderate to severe to debilitating and profound. The higher the burden, the greater the risk for caregiver physical and mental health problems, higher levels of stress, possibly burnout. So besides features of the care recipient placing greater risk of burden on the caregiver, personal and occupational issues of the caregiver may also be involved in their own burden. Things like this. Do they have support from their family members? Do they take time for breaks? And do they move away from the caregiving schedule for long enough to heal themselves or to recover themselves? Do they have enough time for their own personal needs, for their life? Has their life been taken from them? Can they still attend leisure activities like concerts or movies or going shopping, recreation, social life, social contacts? Do others around them, okay, they're doing all this caregiving, do others around them lack appreciation of that caregiver? That's a terrible thing, and that will chip away on that person. Do they have poor finances, low income, lack of education about the disorder or disorders that they're, caring for, the symptoms and the medications and possible side effects of the medications and sundowning and personality changes? I mean, folks, this is not an easy thing. Being an informal family caregiver. And I see it with my own eyes because my beautiful family that I married into care for mom and dad. Dad's 98, mom's 88. They still live in the home, their own home. But all of their adult children have a schedule and a feed on their phone. They all have shifts, Monday through Sunday. 365, every day of the week, every month of the year. It's such a beautiful thing. Here are my final thoughts. Caring for someone with a neurological condition, we know it can be very challenging and stressful. And as the disorder progresses and the care recipient becomes more dependent, caregiving can lead to physical and emotional burnout. as well as a very high risk of the concept. That's the main takeaway of our video and my article, caregiver burden. How heavy is caregiving? And what is it doing to the caregiver? Many caregivers pay so much attention to the person that they're caring for that they forget to take care of themselves. And as a consequence, they may suffer from numerous negative physical, mental, emotional health outcomes. Learning about the care recipient's condition, important. Managing caregiver stress, vital. Self-care, and how to reduce the risk of burnout, all can pay very big dividends for the caregiver in the end. Thank you so much. I'm Dr. Jim. Keep coming back for more articles, videos, and whatever else we have for you. Take care. I hope you enjoyed the video. And if you're looking for online continuing education, CEUs for your own license, check out CEU Academy, where we create fresh content every single year, very timely, important topics. And tell your colleagues who are licensed healthcare professionals as well. Follow the link below and check out ceu.academy.